What is hypersensitivity? An overreactive immune response against foreign antigens or failure to maintain self-tolerance that may result in tissue damage. Allergic rhinitis, or hay fever, is the most common type 1 hypersensitivity reaction. This image shows the manifestations of allergic rhinitis: red, itchy, watery eyes, sneezing, congestion, runny nose, itchy or sore throat, post-nasal drip, cough, and itchy ears. The following skit shows allergic rhinitis at a cellular level. An antigen sticks onto a B cell and is processed internally. It is then presented on the MHC class II receptor protein. A T helper cell will come along and attach to it. We now have the T helper cell B cell complex. The cytokine interleukin-4 is released. Interleukin-4 stimulates the B cells to differentiate into plasma cells and memory cells. The orange bean shapes represent plasma cells, and the red circles represent memory cells. The plasma cells secrete IgE antibodies. IgE antibodies distinguish type 1 hypersensitivity and play a role in allergic and parasitic infections. IgE antibodies stick to mast cells and basophils, sensitizing them. Here we show a mast cell covered in IgE antibodies. Upon secondary exposure to the same antigen, histamine is now released, which acts on surrounding tissues, causing vasodilation, increased capillary membrane permeability, as well as bronchial constriction and mucus production. Allergic rhinitis. Step 1. Antigen enters nasal passage. Step 2. Antigen attaches to B cell, is processed and presented on MHC class II protein. Step 3. T helper cell binds to B cell. Interleukin-4 is secreted. Step 4. B cell stimulates production of memory and plasma cells. Plasma cells secrete IgE antibodies. Step 5. IgE antibodies attach to mast cells and basophils, sensitizing them to antigen. Step 6. When antigen binds to antibodies, histamine is released, thus causing allergic rhinitis symptoms. Now we are going to talk about anaphylaxis, which is a systemic hypersensitivity reaction. Systemic anaphylaxis is a shock-like and often fatal state, the onset of which occurs within minutes of a type 1 hypersensitivity reaction, usually initiated by an allergen introduced directly into the bloodstream or absorbed from the gut or skin. A wide range of antigens have been shown to trigger this reaction in susceptible humans, including the venom from bees, wasps, hornets, and ants, drugs such as penicillin, insulin, and antitoxins, as well as seafood and nuts. If not treated quickly, these reactions can be fatal. Epinephrine is the drug of choice for treating systemic anaphylactic reactions. Epinephrine counteracts the effects of mediators such as histamine and the leukotrienes by relaxing the smooth muscles and reducing vascular permeability. Epinephrine also improves cardiac output, which is necessary to prevent vascular collapse during an anaphylactic reaction.
Oppan Gangnam Style. Gangnam Style. Oppan Gangnam Style.